November is Lung Cancer Awareness Month, and Dignity Health Cancer Institute is sharing with us their unique path of care for someone diagnosed with lung cancer. And with us is Dr. Ratna. How are you doing, sir?
I'm very nice. How are you doing?
I'm very good now that you're here, because it's very interesting about lung cancer, especially when we're starting to hear about it a little bit more from people who never smoked, who pretty much have never really had any health problems. Maybe cancer's never run in their family, which is so important why this month is to bring awareness to this.
Yes.
But before we go any further, let's talk really quick about Dignity Health Cancer Institute and how important that is to our community.
So Dignity Health Cancer Institute is one of the premier cancer care centers here in the Valley, and it is on par with any of the best cutting-edge centers that you could find in the Southwest. And this was actually started roughly around like 5 years ago, and I'm here for the past 3 years, and we do yeoman service, and it is a self-integrated facility, and we actually primarily treat all types of cancers, solid tumors and hematological problems, and we compartmentalize into specialties. Like, I'm in charge of lung cancer and head and neck cancers, which is my specialty. I'm a trained medical oncologist and hematologist. So we have gastrointestinal cancers, and we have kidney cancer, so skin cancer. So we specialize, and then we offer cutting-edge science in terms of trying to alleviate the problems.
And it's amazing that people travel from all over the world to come here to sit and talk with you, to learn what they can do to of course, help them, hopefully, fight the disease as best they can, or find a way they can control it or work with it. And that's the thing. So let's talk about what lung cancer is, because it's very interesting, because I mentioned, people are getting like Kathy Griffin, who never smoked in her life. She never really knew about cancer running in her family like this.
So basically what happens is smoking is one of the main factors in actually causing lung cancer. But apart from smoking, in people who are never smoked, there is actually random mutations that happen, because our body has genes that are actually like drivers for these cancers, but they are always in a suppressive mode. So when these oncogenes, these are called as oncogenes, so when these are turned on because of stimulants, like smoking is one of the stimulants, then it basically promotes the formation of cancer. Basically, cancer is nothing but a normal cell that becomes immortal. That's what happens. So it keeps on multiplying. Normally, all these cells should die at a certain time point, which is the fundamental principle of life. But these cancer cells keep on multiplying, and so it is actually a mutation that happens random, that they are trying to look into it. But they are more common in Asian women non-smokers, for which we have targeted therapies. So they have devised, by precision medicine, in terms of finding out the genetic mutation in these cancer tissues, and they have actually brought in the immunotherapies now since 2012. From UCLA is the one that pioneered Keytruda, which you see a lot. And actually, when they did the study with 550 people, and in 3 years, the FDA found so much benefit, so they actually approved it. And before this immunotherapy, which is a part of what is called precision medicine, the average life expectancy around for 5-year mark is only about 5.5%. Now it became 15%. That was actually in 2018, and it has been incorporated into several types of cancers, not only lung cancers like bladder cancers, skin cancers, and kidney cancers, and even in breast cancers, and now they have branched into hematological malignancies related to blood cancers.
And this is with a lot of doctors working together with you and people coming forward. Is there a way to prevent lung cancer?
Yes, certainly. It needs some self-discipline, personal discipline, like we should not go near smoking. See, we should have actually a movement trying to educate people the harms of smoking, and we have come a long way, but we need to take on that. So shy away from alcohol and smoking. And don't encourage smoking, and don't be around people who smoke. And that is the best. And our Northern Thoracic Institute is a premier lung transplant center that has a whole team of dedicated surgeons. And we have the lung cancer prevention, the low-dose CAT scans that we do in terms of trying to enroll people. So Dignity is a self-integrated, it's a multi-specialty center, and all we expect is that if they have a problem, the community physicians can refer the patients to us, and then we take it. We have nutritionists, we have social workers, we have speech and swallow personnel, and also physicians, radiation oncology down there, and also all scans, everything is self-integrated into that facility.
Wow, it's amazing. And we're just touching upon this right now with the doctor, but again, I'd love for people to go to the website, which is very easy to do, to find out more. And wow, doctor, I wish I could spend more time with you, because this is very interesting, especially as we are going to be, of course, going into, you know, the holiday season, different things, and sitting down and talking with family members about, of course, all types of cancer, but bringing lung cancer awareness, as we said, secondhand smoke and everything to watch out for. So, and
I want to thank AZTV and all you wonderful folks trying to educate people on several aspects.
Yeah, that's what we're trying to do. So, Doctor, thank you.
Thank you for your time.
And if you want more information about Dignity Health Cancer Institute, you can go to aztv.com/help, and you will see, of course, all the information there for them, which is so important. So, thank you. All right, Doctor, thank you very much.